All right. Hello, class. Welcome back. This is day 2 of our skeletal system lesson. So I'm going to go ahead and present my screen with you. You should be on our Google Classroom weekly slideshows. When you get to today's lesson, you will see we are going over slides 14 to 30. This YouTube video is presented here, and you can click for your assignment. Make sure to take some notes in our body system lessons. We have lots of information. So take lots of notes on test, which we have a test at the end of this week. I like numbers. I like knowing that you guys understand the anatomy and what certain things do in our bodies to give us a little bit more appreciation to how to take care of it and why we should take care of it. So when you open up the slideshow, go ahead and get to page 14. And here's your do now question. Explain what a ligament does. If you remember what a ligament does, I'll give you guys a few seconds and then I'll explain it. So if you're sitting there like, what is a ligament? Remember I told you a ligament is like a piece of tape. It's a piece of tape that hooks two bones together. You might have 3 pieces of tape for 2 bones. You might have 4 pieces of tape. It just depends like how big these bones are. On my pinky, you have a ligament on one side and a ligament on the other side. However, on my knee, I have a ligament on the sides and I have ligaments on the front and back, right? So ligaments are pieces of tape that hold your bone together. All right. Today, we're going to talk about bone diseases, right? So the first bone disease we're going to talk about is rheumatoid arthritis. I know you guys are all looking at these pictures on the bottom of the hand. I'll get to that in a second. So what is arthritis? Anytime you guys see the word itis, I-T-I-S, that means inflammation of. If you have laryngitis, it's your larynx is inflamed. That's why it's hard to talk and it hurts, right? Because it's your voice box. If you have bronchitis, those are in your lungs. It's hard to breathe because it's inflamed. Well, arthritis, arth means joint. So you have inflammation in your joints. A lot of people have arthritis. It's like their hands or whatever part of their body has arthritis, it hurts. A lot of like hairdressers or clerical workers, if they're constantly typing or like blow drying or fixing some hair, they might get arthritis in their wrist joints. It just becomes really painful and inflamed, right? A baseball catcher, they might get arthritis in their knees. A basketball player, because they're constantly up and down, jumping, that kind of stuff, right? Arthritis. Do we all get arthritis eventually? Yeah. Some of us a little bit more than others. Depends on the type of job we have or just the wear and tear of our body. So if you look up here at the top picture, I told you guys, wherever you guys have 2 bones that come together, it's a joint, you have cartilage in between. This cartilage, that little marshmallow to help cushion it. The cartilage eventually does wear out. But you also have what they call synovial fluid. It's like liquid in there to make it nice and movable. Well, eventually what arthritis does, it's like that cartilage wears out. Like I told you, it's just the grind of things. And it's like bone on bone and it hurts. It's painful. Rheumatoid arthritis, however, is something where it's like your immune system attacks itself. You say, why does it do that? They don't know. Well, if your immune system is tripping out, it's attacking itself, it's attacking the tissues. And it's attacking these tissues around the joints, which, as you can see in this picture, makes those joints a little bit more inflamed. When something is inflamed, it's swollen, causing more pain, and can actually attack it enough where it could deform that joint. That's why if you guys see down here the picture of the fingers, that's normal. And then this is probably a minor case of rheumatoid arthritis and then a severe case. So it's attacking those joints and it's causing deformity. This isn't something that's contagious. However, rheumatoid arthritis can run in families. Like I said, every one of us get probably mild arthritis. However, rheumatoid arthritis is genetics, right? All right, moving on. Osteoporosis. Whenever you see the word osteo, that means bones. Okay, whenever you hear the word osteo, bones. We talk about in your ear, you have 3 ossicles. Ossa is bones, right? 3 little bones in your ears. Where osteoporosis is when pretty much your bone starts to deteriorate. We have in our body, we have osteoclast, osteoblast inside your bone. So anytime you guys are eating healthy food, it builds your bone up. If you break your bone says, shh, I'll help put it back together. Unless it's crazy broke, which we'll learn here in a second, and the doctors have to help you. If we don't take care of our bones aren't going to be as strong, or however, some of us might have osteoporosis running in your family. So what that means is if you look at this picture, that's a good healthy bone. If you guys are trying to figure out what bone this is, this could either be your femur or your humerus, okay, because they look the very same. I won't know until you get down here. So anyways, so this healthy bone, nice and strong. As you see the bone next to it, the osteoporosis, that spongy bone, it's like looking like it has more holes in it. It's more brittle. So it's happening is the creation of new bone, it can't keep up with the removal of old bone. So your body's constantly getting rid of old bone, making new bone, getting rid of old bone, making new bone, just like your skin. Okay, I told you when you scratch your skin off, that's dead skin cells, but you have new skin cells already there. It's already keeping up. Someone who has osteoporosis, they can't make enough new bone to keep up with the old bone. So they become more brittle. They're more likely to fracture their bones. They're more likely to have injuries. Usually this happens to older adults, right? So it's really, really scary if like grandma falls and she has a hip injury and could be a broken bone, which leads to certain surgeries. So it could be a little scarier. So that's all it means is it's brittle bone disease. All right, we talk about bone cancers. All right, cancer, it comes in two forms. It could come in malignant or benign. Cancer is cancer. So, but cancer could affect anywhere in your body and it could spread anywhere. Hate talking about cancer. I have lost family members to cancer. I'm pretty sure a lot of us out here have as well. So when it comes to cancer, there's two types of tumors. The first one is called malignant. Okay, malignant tumor, and the second one is a benign tumor. If I had to pick which tumor I wanted, obviously I would choose a benign tumor because benign means it will not spread. So this is where I say you guys judge your body. Like you guys, when you're in the shower, if you notice something wrong, talk to mom, dad, whoever you live with, get it checked out. If I feel a bump on my skin, like what is that? I don't know what that is. Get it checked out, right? They might go do some tests. It could be a benign bump, a benign tumor. They go in there, they could remove it. Okay. If it's malignant, unfortunately, malignant means it can spread, okay? And it could spread. It might start off in your bones, but we all know blood goes everywhere in our body. It could start in my bones, and then those cancer cells, it's like plaque in your teeth. I told you it's just going to have a party, right? That's what cancer cells do. They're going to just spread wherever the blood takes it, which is everywhere. And unfortunately, if we don't catch it soon enough, this person might now be in what they call stage 4. How do you protect cancers? Some people might need to have chemotherapy. Some people might need to have radiation. It's a long process. It could be a hard process. It could be a quick process. Everyone's different. But like I said, just be judges of your body. Know what feels right, what doesn't. Get it checked out. Rather be safe than sorry. Rather know sooner than later. All right, let's move on. So this shows you guys a type of bone cancer called osteosarcoma. Osteo means bone. Remember, this usually happens around teenage boys, usually around this time because you're having growth spurts, and usually around your knee because you just grow really, really fast. It's like a growing pain that doesn't go away. You guys know sometimes, like, man, my bones hurt. A lot of people say those are growing pains, but you're like, this one doesn't go away, right? Or if you feel, like I said, a bump on your body. True story, I had a soccer player a few years ago. She had a bump on her shin bone, and she didn't think anything of it. She just thought someone kicked her in the shin during a soccer practice. She didn't wear shin guards. Well, that bump wouldn't go away. And after some time, she showed her parents, went to the doctor. They felt it. They did what they call biopsy. So they'll go in there and they took like a little graft of it. They did their microscope. They looked through it. And it came back as cancerous. Now, good news was it was only benign. Okay, cancer's still scary, but it was benign. That means it's not going to spread anymore. Well, they wanted to get rid of it. So she had to go in, have her shin bone cut open. Shin bone's on your leg, right? Have it cut open, and they pretty much shaved off that part of her bone, right? She had to sit out of soccer for a few weeks, and obviously every few months have a checkup. She is good, cancer-free now, but that's just knowing your body. When something doesn't feel right, get it checked out. This x-ray is showing, if you look in this upper arm right here, right, that's showing that there is a tumor growth in that area. Can't tell unless they do a biopsy if it's benign or malignant. Remember, malignants can spread anywhere. Benign means it'll stay in that localized spot, but still can cause some issues. All right. Now we're going to talk about breaks and fractures. All right. There are 5 types of breaks or fractures. First type is called closed or simple. This is where your bone, it doesn't matter. It could be my arm bone, my pinky bone. It could be my femur bone. Any bone can fracture in any way. So a closed break means it's just a little simple fracture. Doctor will put you in a cast, and your bones actually take care of themselves. The cast isn't magical powers. Your cast is there just to protect it from another hit hurting it. So what happens in that closed fracture? Your osteoblast and clast come together, and it's like they fix it. They fuse it together. This one, the open fracture, it's open because it's breaking through your skin. This one, a magic casting isn't going to work. Doctors are going to have to go in there and like reset that bone, possibly have to put a rod in it, right? Now, they'll probably still cast you up, but this one is popping out of the skin. It ripped through muscles, probably tendons and ligaments. There's more than just put it on a cast and letting the bone fix itself. This one down here is called a transverse fracture. That just means it's cut diagonally. It's broken diagonally. This one down here, a green stick, I'll talk a little bit more here in a second. A green stick is more like a little splinter, right? I'll talk about that in a second. And then this one down here is called a comminuted fracture. That one is just shattered. This one's going to need some surgery, some rods, some plates, some screws to literally hold it back in place. All right. Now, I'm going to warn y'all, I don't know what slides, but some of these slides might have some gnarly pictures, so just be ready for it. Okay, this one's not too bad. Okay, so this is showing the difference between a simple closed fracture and a compound fracture. As you can see, the compound fracture, it's popping out of the skin. So you might think, oh, it's just a broken bone. Well, you got to think, it broke the bone. It probably, well, it had to tear through the muscle, tear through tendons, and obviously tear through the skin. So this isn't just fix the bone. This is, we got to relay the muscle, the tissues, all that stuff that comes with it. Hopefully it didn't ruin any blood vessels, right? So anytime someone breaks a bone, especially in an area where there's huge arteries, it's really scary because it's not just the broken bone that's a concern. It's, did it rupture an artery, right? All right, moving on. So here's some x-rays of simple fractures. If you guys look here, this is actually your tibia bone. If you look right here, here's your ankle. So this is a fracture of your lower leg bone. And then here is your radius bone. The radius is your thumb side, and then your ulna is your pinky side. So your radius bone right here. So these are just simple fractures. Doctor might go in there, just set it, put a cast on, and depending on how bad it was broke, depends on how long you'll need that cast on. Oh, there's a picture of it. Now this one possibly is shattered. This one could have been an open fracture, but you don't see it coming out. But if you look here, it's not just the bone that's broke, right? That bone is probably popped out here, and it probably tore through the ligament, probably, which connects this bone, which you can see here, to the wrist. Obviously, that ligament's not connected anymore. So this person's probably going to have surgery on their ligament, and think your muscles and tendons also connect to your bones. So there's other issues going on here. Okay, told you I'm talking about a green stick fracture. Green stick fractures occur in children, right? I can't have a green stick fracture anymore because my bones are nice and solid. I told you kids' bones are more like cartilagey for a little bit, so they're a little bendy, right? So their bone technically doesn't break all the way through, it splinters. Think of like a very new tree, okay? Very new tree. When it starts forming its new limbs and branches, they're like greenish in nature. If I say pull off a stick and try to bend it and crack it, you can't. It's just going to bend, right? That's very similar to babies and children's bones. So if they break a bone, it's more of a splinter. Sometimes they might not be able to diagnose that a green stick fracture happened, right? A lot of people think, oh, they just hurt themselves because you can't diagnose it. This is showing you guys some pictures. So this is a green stick fracture. It didn't go all the way through, right? Same thing here. It like splintered it. Think of that new green stick of a tree. You can't crack it. It's going to be splintered, okay? True story. My nephew, when he was about 2, 3, he was learning how to walk, crawl. He was crawling, learning how to walk. He actually broke his left arm. They didn't know it for a few days. They started noticing, my sister and brother-in-law, like he was using his other arm, didn't think anything of it. Took him to the doctor. Eventually, they're like a day or two later, they said, okay, something's going on. Took him to the doctor, and they did an x-ray, and he had a green stick fracture, right? It hurt him, but not too much to notice anything of it. But when they did notice things weren't looking right, they took him, and it was just a little fracture. Now, whenever you guys break a bone, the important thing is the doctor's going to make sure if you broke a growth plate. In between every bone, think the middle of every bone, whether it's your little pinky bone or your big femur bone, in the middle of every bone, you have what they call a growth plate. That is where your bone's constantly growing to make it bigger. Well, my nephew broke his arm. I was asking my sister, ooh, where did he break it at? Because if it's the growth plate, that could affect that bone from growing to its normal length. Doesn't mean he's going to have an arm really, really short compared to the other, but it could be a little bit shorter than the other. Well, good thing he didn't break his growth plate. Now, my growth plate, since I'm obviously over 25, they're nice, done. So if I break my bone, it's not like my bone is going to be shorter than the other because they're done growing in length. However, you guys, if you break near your growth plate, there could be a situation where if it damages that area that makes your bones grow, there could be a slight difference in the length of your bones. All right, moving on. So this shows you a green stick fracture. Can't really tell it's a broken bone. A lot of people might think it's a sprain. It just hurts, right? It just shows like the bendy of that bone, of that break. All right, so these are the fractures that they're shattered, all right? If you have your body bone shattered, you're going to need plates, rods, screws, And some of you guys might need to keep those plates, rods, screws in there forever. Some of you guys, they might keep them in and have surgery to take them out. Just depends on how bad that bone was splintered and broken. Now, like I said, it's not just the bone that they have to fix. You're looking at ligaments got torn, muscles, tendons. Hopefully it didn't hit, like I said, blood vessels, arteries. So this is when it gets really, really, really scary. All right. I'll put this on here. I just want you guys to tell me what bone is this. So this bone right here, can you guys tell me what bone this is? That's right. You guys first probably had a guess. Oh, it looks like it's a ball and socket. So it could have been the shoulder or the hip, right? But then when you look over here, you can see these are your ribs. So obviously that is your shoulder, right? This is called your humerus bone. This is your scapula. So it's right up here. So as you see, this person has a rod and screws that they shattered their humerus bone, and that had to keep it in place. Okay. Oh, told you some gnarly pictures. All right, so here's some open fractures. So let me show you down here. I know everyone's probably looking at this one. So this person, their tibia and their fibula bone literally popped off, and it is an open fracture. Now, this isn't just resetting the bone. Like I said, this tore the tendons, this tore muscles. This looks like it tore through some blood vessels. This tore through ligaments. This person had to have a lot of surgeries just to get that foot and that lower leg bone back in normal health. And then they have the rods, their screws to set it and keep it still. Now, this x-ray picture doesn't look as gnarly, but it's an x-ray. If you could tell, this ulna, which is your pinky side arm bone, pops through the skin. So you can't tell, but it would look just like this because it popped through the skin. It ruined the ligament that connected this bone to your wrist, the muscles, the tendons. So not only will they have to reset it, but they're going to have to fix all those ligaments and tendons that it affected as well. Oh, here's some more open fractures. My medical people, this is stuff you just be ready for. If you gross out or can't do this, then you probably won't go in the medical field. This is a femur. Remember I told you longest bone in your body? The femur is one of the scariest bones to break because you have a huge artery. It's called your femoral artery that literally pumps all the blood to your lower body, right? Like we have arteries everywhere, but huge arteries, we have some in our neck, we have them in our wrists and elbows, and then you have them in your femur, right? Your femur is what literally takes all the blood down to the lower of your body. So if someone fractures, and this is a bad one, that's why you see a whole bunch of blood clots, this could be really scary because this could be deadly if it literally ruptured that artery. That means there is no blood getting to this area. There could be some huge problems with that. This one's showing obviously the elbow bone. That is, it looks like the ulna is your pinky side. The ulna is popping through on your elbow. That's an open fracture. Okay, last thing I want you guys to do in your notes. So if you have broken a bone before, tell me about it. Maybe what bone did you break? How'd you break it? Do you know what type of break it was? If you've not broken a bone, so if you're like me, I've never broken a bone before, knock on wood. I have a couple chip bones in my ankle from just constant sprained ankles from playing soccer all my years. But if you've not broken a bone, just tell me something interesting about you. It doesn't have to be bone related. Just tell me something interesting about you. Okay, so as you guys are answering that, I'm going to go ahead and close this up. So today we talked about a lot of bone injuries, a lot of bone diseases, from osteoporosis to different types of broken bones to rheumatoid arthritis. We learned about your ligament attaches bones to bones. We talked about different bone joints the other day, the number of bones in your body. How do you take care of your bones? Protect them. If you have to wear a helmet when you're riding a bike, a skateboard, wear your helmets, right? You only get one skull and one brain. Take care of it. Eat healthy foods, especially foods high in calcium and vitamin D, like your milk, your dairy, your cheese, that kind of stuff. That is really, really good for your bones. So I told you yesterday, your bones stop technically growing in length around 25 years old, but doesn't mean they don't stop growing in strength. So my bones, I'm not going to get any taller than 5'3". If anything, I might get a little shorter as I age, right? Now, I'm not going to go from 5'3" to like 4 foot, but maybe by the time I'm in my 70s or 80s, I might be 5 foot, right? But my bones can still be strong. I'm still taking care of them by exercising, eating healthy, right? Taking care of my body means my bones are going to be strong, and I'm less likely to have injuries. I'm less likely to have certain disorders and diseases. Understand your family history, what runs in your family. And have a little bit of like a one-up. You could be prepared so you don't have that strike against you. So I hope you guys learned a lot about your skeletal system. And I hope you guys are ready for our test tomorrow. All right, I'll see you later. Bye.